Guys, my name is Yesenia and I'm going to be going over ethinyl, estradiol, and norethindrone with you guys today. So, as many of us already know, ethinyl, estradiol, and norethindrone is a birth control oral contraceptive. Some brand names underneath ethinyl, estradiol, and norethindrone are Lolestrin FE, Estrostep FE, and Nikon. What is birth control used for? Birth control is used for preventing pregnancies, regulating periods, regulating blood loss in periods, which can also help with iron deficiency anemia. Birth control can also reduce period cramps and can also protect females from endometrial and ovarian cancer. Also, birth control can help with the management of acne. So how does birth control work? Ethinyl, estradiol, and norethindrone is a combination pill that contains female hormones that prevent the release of an egg into an ovary. The combination pill works by thickening the mucus of the cervical and uterine lining, making the process of fertilization of an egg harder. Also, because the mucus of the cervical and uterine lining are thicker, the fertilized eggs cannot attach to the uterus. How to know if birth control is working? Well, the answer is simple. Effectiveness of birth control can be confirmed by no conception, meaning there's no birth or an egg was not fertilized. Guidelines for birth control and when taking birth control. A negative pregnancy test is required before taking birth control. Patients who smoke are encouraged to quit smoking due to the increased risk of blood clots, strokes, and heart attacks. Patients who are over the age of 35 and patients who smoke and are over the age of 35 are usually not recommended to take this medication because of the increased risk of blood clots, strokes, and heart attacks. Patients who are pregnant should also not take this medication because there is an increased risk of birth defects that can happen during pregnancy if you're taking this medication. Routine follow-ups and examinations are encouraged throughout your therapy, meaning we would like you to routinely check your blood pressure, get breast examinations, abdominal examinations, and pelvic examinations. It is also recommended to get pap smears every 6 to 12 months. Birth control comes in more than one form. Birth control can come in transdermal patches, vaginal contraceptive rings, hormonal IUDs, and birth control shots. Forms of oral birth control can vary from the forms of oral birth control can contain either 21 active pills or it can have 21 active pills and 7 sugar pills which are inactive. How should birth control be taken? When beginning oral birth control for the first time, for the 21-day regimen, the first active pill should be taken on the first Sunday after your period begins. For example, if your period begins on a Sunday, the pill can be taken on that same Sunday. Pills may also be started on the first day of your period. Regardless of the 21-day regimen or 28-day regimen, the 21 active pills must be taken at the same time every day for this medication to have full effect. What should you do if you miss a dose? So this is very important information because I know a lot of people get busy and doses are missed. So if you miss one active pill, you should take the pill as soon as possible or as soon as or you can take the pill the next day, but you have to take 2 of them the next day. And then continue taking 1 pill per the rest of the pack. If 2 active pills are missed in a row during week 1 or week 2, then take 2 pills per 2 days. Take 2 pills per day for 2 days in a row. Then take 1 pill per day for the rest of the pack. Also, it is important that you use, and I cannot stress that you use, a second form of birth control for at least 7 days following the missed pill. If 3 active pills are missed in a row during week 1, week 2, or week 3, immediately stop taking the medication and use another form of birth control if you are sexually active until your next period begins or until pregnancy is ruled out. As soon as your period begins or pregnancy is ruled out, a new packet of pills can be started. Side effects of birth control. Some side effects of birth control that you need to know are that birth control can cause thromboembolic events such as myocardial infarctions, pulmonary embolisms, thrombophlebitis, and strokes. It has also been known that birth control can cause hypertension, breakthrough or irregular bleeding, breast cancer, hyperglycemia, and hyperkalemia. What you should report to your healthcare provider. Immediately notify a provider and discontinue the use of birth control if one or more of the following occur. So, if you suspect a pregnancy, swelling of the ankles and feet, and weight gain, pain, swelling, tenderness around extremities, headaches, chest pain, blurred vision, which could be a sign of a thrombolytic event. Yellow skin or eyes, dark urine, or light colored stools, which is a sign of hepatic dysfunction, and abnormal bleeding. A healthcare provider should be notified immediately, and discontinuation of the drug should occur. I also have a handout underneath this video, so if you would like to see it, you are more than welcome. And if you have any questions, you can just type